Assalamualaikum. My name is Professor Shahrul Amry Hashim. I am a consultant cardiothoracic surgeon at Damansara Specialist Hospital 2, and I've been in this hospital for the last 2 years as the main cardiothoracic surgeon. Heart surgery has progressed over the years. We are very fortunate that Damansara Specialist Hospital 2 has embarked in this advanced procedure called the minimally invasive cardiac coronary artery bypass surgery for the last 2 years. So this is a very important milestone for KPJ Healthcare. But for us to move forward, I think it's very important that other KPJ hospitals in the region also embark on the same procedures. Heart surgery is a complex procedure, more so in minimally invasive heart surgery. For us to help our sister hospital, which is the Johor Specialist Hospital, it is very important that the whole team visit our unit in Damansara Specialist Hospital 2 to get exposure in this procedure before they embark on the procedure on their own, of course with our help and guidance. Minimally invasive heart surgery is the most advanced heart surgery, and we are able to offer patients in the Kuala Lumpur and Lembah Kelang area at the moment. But of course, our ultimate aim is to be able to provide these services throughout Malaysia. So it is very important that Johor Specialist Hospital will be the second hospital in the KPJ healthcare that will be embarking in the minimally invasive heart surgery. So how does this benefit our patient? Patient doesn't need to travel to Kuala Lumpur anymore. They can stay in the southern region to have this procedure. So with this collaboration, ultimately it will help to provide the procedure nationwide, and of course with one center collaborating with the other, that will enhance the safety of the procedure.